Welcome back to Everyday Ancestral, where we challenge modern norms with timeless wisdom. Today's world has more gyms, gear, and gadgets than ever before, so why are we in more pain than ever? My guest today is Dr. Josh Schachter, an orthopedic surgeon who's seen firsthand how modern life breaks the body and how ancestral movement, alignment, and recovery might be the keys to healing it. Whether you're dealing with chronic pain, recovering from injury, or just trying to move better and feel stronger, this episode will shift how you think about your body from a machine to a masterpiece that's always adapting. So let's dive in. Are most surgeries actually necessary? Or is the system overreacting to fixable problems?
So I think we have to really differentiate. I want to say I'm an orthopedic surgeon. I've done 15,000 orthopedic surgeries. So, but I'm not a general surgeon. I don't work on hearts or brains. So when we say surgery, we're going to talk about joint surgery, right?
Perfect.
Musculoskeletal. That's what I know about, man. So, and I'm going to tell you that our system is broken. It's completely broken. Um, we are living in a system in the traditional orthopedics in the United States where a vast number of surgeries that are done in this country are done before they're medically necessary. And joint replacement surgeries in particular are a concern to me personally. Um, I was the director of an orthopedic center of excellence for hip and knee replacement for a decade. And over the time when I've practiced orthopedic surgery, I have seen the amount of surgery done increase dramatically. And we're doing surgery on joints which are in some cases not to the end stage, right? For
What do
instance,
you mean by
about
what do you mean by the end stage? What does that mean?
yeah, so when we do a knee replacement, it's a wonderful procedure, except it's in terms of success, a knee replacement can be great. But if you don't have bone on bone arthritis, if you don't have a lot of joint destruction, if you're only sort of in the moderate phase of arthritis where you have a little bit of cartilage inflammation or irritation, then doing a joint replacement on those knees is not as successful. And it's happening more and more often as we're being more and more aggressive with surgical interventions in this country. About 35% of joint replacements as of 2018 were done before completely medically necessary. And that's really a concerning statistic.
Why do you think doctors are jumping to surgery? Is it similar to like antibiotics where they're just like, "Oh, I'll just prescribe antibiotic." Is it lack of is it just the system doesn't want to take time to really like naturally support the person or why do you think this is happening?
Well, we're seeing more and more. I mean, first of all, orthopedic surgery is one of the biggest drivers. It's one of the biggest money makers in a hospital system.
Ah.
Bing, right? So, and
Hmm.
more surgeons nowadays are employed by hospital systems. And I'm sorry, brothers, you're working for you're working for an evil empire in a lot of cases. Some of you may be very happy. And so when you're employed in a situation where your specialty is a big cash cow, then there's definitely a push for you to do more surgery in the organization, right? In
Interesting.
those big hospital systems. And so that is a pressure on modern orthopedic surgery. But we really, in my opinion, we're not using the solutions that we that we evolved with, right? We're not optimizing our own regeneration. We're not intervening before the joints are too far gone. And we're doing damaging treatments to joints now that are temporary, like steroid injections, right? And certain types of medications. And we're sort of giving people maybe 1 or 2 steroid injections, ordering a very short course of physical therapy, asking them to make no, activity modifications or looking at their metabolic system as a whole. And then we're recommending surgery because these very limited measures we've tried for the past 3 months failed. It's really common to see a person with knee arthritis, knee pain come to an orthopedic surgeon's office and they'll look at an x-ray, they may order an imaging study, and then if you have moderate arthritis, you might get a steroid injection, come back in 3 months and see me, I'll give you another steroid injection, and if it doesn't get better, then we do surgery, right? In a lot of cases, we'll order physical therapy, but it's maybe, for patients to fail physical therapy can be as little as 2 visits with a physical therapist. And they document that the patient is not a rehab potential because they continue to have pain after 2 visits, and then we recommend surgery.
Is anyone asking the question of like, well, why are we experiencing so much pain? Like I think of like why are muscular skeletal issues skyrocketing even though we have more fitness options and we have more systems in place, if anything there's more gyms in place, there's more people are technically being more active, at least I think, but there's also more and more awareness around warming up. There's more awareness around recovery and strength, like taking time off.
Mhm.
So where is the disconnect happening, you think?
The problem is there's a couple. We know that joints are really built for use and a certain type of use, the way we evolved, right? Normal walking stance and a normal running stance, normal squats. Our activities now, our daily life is hard on our joints. Sitting in a car for hours at a time is not good for your joints, right? They need to move. They need to be there. Joints have no direct blood supply, so they need to be moved, and they need to be moved in an appropriate way. And I think also that inflammation is this very modern problem. And even though we're really looking, I mean, a lot of us really care. Like a lot of us really care about how we move and what we eat. And we're thinking really critically about our joints and our own health. But in our society, our diet is so inflammatory and toxic, right? In America, processed foods are an epidemic, and they're causing really severe problems in our health, and we see that manifested in the joint as well. Um, Inflammation in your joint is a lot to do with what you put in your mouth.
Interesting. So in a sense, you're saying like we're seeing specific types of injuries that maybe we didn't see, I don't know, 25, 30 years ago, and it has to do potentially with the food systems.
Absolutely. Oh, yeah. Absolutely. It has to do with our own metabolic systems and how, we're all get in modern America, we're eating processed a lot of us are eating processed food in the majority of our meals. Those foods have been shown to be inflammatory. And when you're in a chronic inflammatory state, when you have a high degree of inflammation, your tendons don't heal the way they should, right? Your ligaments don't heal the way they should. And so we develop these, chronic problems, and we see them in younger and younger people nowadays. Used to be that you'd see, a lot of shoulder pain in older folks, but now we're seeing it in younger and younger populations. And part of that is because we're living vicariously through our kids in high school sports, right? We're having more injuries, but then also their diet, their metabolism is damaged by their environment and what they're putting in their bodies.
What do you think people are getting wrong about pain? Like I feel like a pain, like when you have pain, that should be almost like you're listening. Like that should just be a clue of like, oh, something's going on. Let me check that out. But are people actually doing that, or do you think they're feeling pain and that they're almost regulating and thinking, oh well, I'll just keep working through that pain. They're not listening. Is that the issue that's going on, or?
Well, I think we do listen to pain. There's lots of business for orthopedic surgeons. So in a way, people are listening to their pain. They're really going down a road that's destructive, if they go the modern medical route of joint pain treatment. And we can get into that in a second. But the question is, are we not listening enough or are we listening too much? I think pain is one of those things it's of course subjective to everybody. It depends on what type of activity you're doing if it hurts. Working out through pain through an injury that's getting worse is certainly not listening to your body, right? So if you have some soreness one workout and the next workout you don't have that soreness, well, that's not something that we need to be super concerned about. But if you have a joint pain that's getting worse through your activity, then a typical time frame that I have people look at if they're able to deal with it 4 to 6 weeks is a good time to listen to your body and try to do things besides see someone like me. But after 6 weeks of pain, then it's a good idea to get another set of eyes on it, right? To look a little deeper into that pain, right? I don't think we need to live for months with pain.
How did you get into this line of work? What kind of what brought you down this path? Where did you experience a lot of pain growing up that made you go, "Oh, hey, I wanna become a doctor that supports, joint surgery so that no one else experienced what I did?" Or what's your story with that?
So, I grew up in central Oklahoma, and my dad's a chiropractor. So the musculoskeletal system is really interesting to me. I grew up, in anatomy labs and with him going through chiropractic school. And so I was exposed to that as a very young age. And I wanted to be a doctor. I didn't decide I wanted to be an orthopedic surgeon until I was in medical school. I've always been an athlete. I was a competitive surfer when I was young. I've always been a mountaineer. I've mountain biked, climbed. Now I kiteboard all over the world and fly my paraglider, but I really love being active, and to me, orthopedic surgery being surgery of the joint, it seemed like, a cool job where I could help people and I wouldn't have to deal with the mind. Because in medical school, I was pretty close-minded about the impact of the mind and, in actual healing. I thought I could just work on bones and joints and I could be a carpenter.
So when you were younger, you saw healing primarily through practical, like, surgical terms, right?
Yeah.
You almost
Yeah,
saw,
very
like,
black and white.
anything that had to do with mind over matter, you were like, "That's woo woo." Is that kinda what you're saying?
Very much. That was really my approach in medical school. Now, bear in mind that medical school is just the beginning of learning what you don't know. So at first I thought, I really didn't like my psychiatry rotation. I thought that was pretty boring. But I really love the idea of, 1, using a hammer at work every day. Um, it was fun. And then 2, I really like the idea of being able to change people's lifestyles, like, to help them live better, right? To walk again is incredible. If you break your femur, your thigh bone, you're really happy with your orthopedic surgeon. And those are big wins that I really loved during my training. And it was also very competitive, and I'm a competitive guy, and so I wanted to be in a sort of a high profile specialty.
So that's Josh out of medical school. What's Josh nowadays like then? Because clearly you've expanded that perspective.
The mind is so important for healing joint pain. For one thing, just doing mindfulness can help us change our habits. It can impact our, stress system. We know that, just good sleep habits and mindfulness can reduce our inflammatory markers by up to 30% without doing anything else. Like, that's bananas. Um, it- but the mindset is such an important part of patient success. And after I have been doing this, when I went out into practice here in Wichita Falls, Texas, in a small town, the community, being out an orthopedic surgeon in this community, you've operated on everybody's, like, uncle, mom. You get stopped in the grocery store like 3 or 4 times. "Oh, you took care of my son." It's a wonderful experience. But what I saw was that positive, when I can give a positive experience as a physician, it not only did it change that person's life, but it really helped their family. So the whole mindset of the community even is important, not just the patient themselves. And as I went in practice, I just really got much more interested in how can I help a patient's healing journey with by by being supportive of the way they think about it, by helping them frame it. And now we know, since we do regenerative medicine and we do functional medicine in my clinic, I don't do surgery anymore. Um, Regenerative medicine is our our minds are so powerful that they affect the ways that our cells behave, right? And so the way that you perceive your treatments has a big impact on how well those treatments heal you.
In a sense, what I hear you saying is the placebo effect is real, like that if you believe it, it's true.
Yeah, exactly. The placebo effect is just an application of our of the strength of the mind, right? The human mind is so incredible that we had to, you know, I think we had to insult it and downplay it by naming it the placebo effect. It cures cancer, man. Come on. I mean, like there's a certain amount of people who are cured of cancer when they try the saline treatment. So I think it's incredible.
Yeah, absolutely. And I love though that your journey started out kind of more, hey, this pays really well and like this is how I want to contribute to society to like, no, no, now I don't want to just make more money and contribute to an individual. I want to change spans of generations. I want to support communities. And to me, it's almost like the release of ego, right?
Mhm.
Like that whole process of as we age, we're less egotistical and we're more like thinking more about the whole.
And that's been my personal journey for sure. I mean, there is nothing I I know that surgeons aren't known for their egos, but I had a pretty good sized one. My ego was fairly large, and you learn things through life. My wife Amber has the breast cancer gene, and I was at sort of the height of my power as an orthopedic surgeon. I was the chairman of our department. You know, I was running this orthopedic center of excellence. I was doing 1,000 surgeries a year. I was working 70 hours and really feeling in my power as a surgeon. Now, I was not spending any time with my kids. My wife, at that time was certainly not feeling close to me. Um, y- I'm spending all my time working. And she had this breast cancer. She has this breast cancer gene, and she was diagnosed in when she turned 31. And at the age of 31, at the height of my power as an orthopedic surgeon, she has all of these surgeries, which changed her body and put her into menopause. And sitting with her through the experience of those surgeries and that time in her life where she changed very rapidly from this young vivacious mother of 31 to at 32 she's going through menopause, you know, risk of cancer, 15 surgeries, all of these things. That changed the way that I saw what I was doing in the world. That changed the way that I saw, myself as a surgeon, and also it changed the way that I think about how we take care of people. Because at that time, I was like, "We're gonna operate on you. We're gonna do 5 and 10, joint replacements a day." There's no time to take care of the human in that scenario if I'm seeing 50 patients a day and my PA seeing 30 and I'm doing 30 or 50 surgeries a week. And the blessing of Amber's illness was that it forced me to slow down and say, "Whoa, there's some other ways to look at this." Medicine is not this high volume, um, you know, high return type of activity. This needs to be well thought out and slower, and we need to spend more time getting to know our patients and their biology and how we can make interventions without just jumping to the next surgery.
Yeah, man, that's really I'm grateful that you came out of that experience with this new awareness. I think everyone in your life is probably grateful for that because and everyone you touch as a surgeon is probably grateful for that because it sounds to me like you recognize that the system was out of or was misaligned with humanity. That almost like the system was focusing on the transaction or the procedure and leaving the human aspect of it, disregarding it, leaving it by the wayside.
Medicine is completely transactional. In the traditional system is transactional. You go to your doctor, you pay your copay, you sit for hours, they see you for 15 minutes, they give you a drug, they schedule your follow-up. That's a transactional relationship. That's all medicine sees, Americans as right now. And that's a real shame. And it took me leaving that traditional system and coming into the functional space and starting to really be involved in the wellness movement and the functional wellness movement to see just how broken the system is and just how just fucked up the whole
Yeah.
thing the whole thing is. You don't get to spend any time with your primary care doctor. Your the people in my community talk about they have to schedule to see their doctor 9 months from now. They can't see him when they're ill. When he sees them, there's 15 minutes, check in on all of their medications. Their doctor's in a huge hurry because he's got a quota of patients he has to see that day because he's an employee. Um, and he very superficially goes over their symptoms, gives them a medication, and then they're out the door. And it's just not giving anybody the care they need. There's no discussion of the in most cases, unless you have a very special doctor, there's no discussion of your diet, and there's no discussion of your actual metabolic health. They do these very basic labs. They look at a very superficial view of the patient, and it shows. In America, we have some of the worst public health in the developed world.
Yeah, which is ironic when we're one of the wealthiest nations. Yeah. It's
Yeah.
it's tragic cuz we're all feeling the effects of this. How can you support empowering those people that are listening to this episode?
Well, I think I can support them by saying that longevity has some very simple foundations. It's how do we move? What do we put in our bodies? And how do we rest? Right? So, and if we really think about it, what you do every day, James, with your business and empowering people's, nutrition, I think is a really big part of what we need to recognize in America is that our food industry is actively trying to poison us, and that sticking to whole foods and paying attention to what we're putting in our bodies is extremely important over the long term, starting at a young age, right? The second thing is that we need to get more rest. And that doesn't mean, hey, I want you to sleep a full 8 hours. Not everybody has to sleep 8 hours, but we're not resting through the evening. Sleep disturbance and sleep problems are rampant. It's one of the largest it's one of the largest causes of mortality, is actually sleep deficit. Not the and the consequences to that to the metabolism. Um, and then how do we move? A habit of more natural movement, like a habit of maintaining our muscle mass and staying active are really critical. And those 3 things are very simple, but our society and the way that modern life works all conspires to work against them. So, your genetics are really only I was listening to a podcast today, and the scientist was saying your genetics are really only 3 to 7% of your overall longevity, unless you have a serious disease that's inherited. And so the rest of it are all things that we can modify using our environment and our mindset and our actions.
Fantastic. I love this topic. So what's one movement you wish everyone would start doing again like our ancestors did? Because you talked about ancestral movements, ancestral patterns or movement patterns, right? That our ancestral life was like. So what's one movement you wish everyone would start doing again like our ancestors did?
Dude, I'm telling you, this just sounds so weird. I've traveled in Asia. And in Nepal, when I was flying my paraglider in Nepal, I noticed that, like, people they don't sit down, they squat. They squat down with each other, and I've seen that in countries in South America. I've seen it in other places around the world. Squatting is actually a really and they squat with great posture because instead of sitting, they're actually squatting there, right? Like, being able to squat and maintain a squat is such a healthy movement for your low back, for your hips, for your knees, for your ankles. I would love to see more people doing deep squats and having and y from a young age. The problem is we can't take, 50 and 60-year-old people and be like, "Hey, you're not very limber. Go ahead and try this deep squat." It's something that we would have to have as a habit and work our way towards if we're older, myself included. But I would love to see a deep squat more often.
Yeah, it's funny you bring up squats because that's a fascinating one because it's true, right? If you think about it, we didn't have chairs way back in the day, so how would you just hang around the fire? Yeah, you might sometimes do like, sitting on your butt and cross-legged or something like that, but most people would probably be squatting.
Indigenous cultures squat, and they squat in community. It's like you'll see I've seen, 30 people just talking, sitting in that squat for a while, like an hour. I couldn't hold that position myself. I don't think a modern American could for that long.
Yeah, you're right. It's painful if you're to your point, if you didn't start young and and it is fascinating because speaking of, like, the Asian culture, like, I've specifically seen old men or old women squatting. Like, that's
Yeah.
incredible, and here we are, 30, 40, 50-year-olds, 20-year-olds, and we can't do it.
No, no, I in the in those cultures, in this where you see these older people squatting, this very natural movement, there's not as high there's certainly not as high a rate of joint replacements. They're not having as many surgeries. If you look even at and I don't know if this is connected to squatting, but if we look at our ancestors, um, indigenous populations don't have a huge rate of arthritis, probably because of the way they move. And you could argue, well, they don't have as long a lifespan, but even older skeletons don't show as much arthritis in indigenous populations. I think it's a multiple things, but I think, you have an 80-year-old person who can squat all the way down.
Yeah, that is
It's very
interesting.
interesting.
It really is. What are some like, you said you have kids, like, with all this knowledge and the change that you've gone through in your lifetime, if you were to have a kid today, uh, a young child, what are 2 or 3 movements that you would encourage them from a young age? Clearly, one would be squatting. What would
Yeah.
the other 2 be?
I I love young age, I think a natural squat to maintain that is great. Um, I love it when kids run and play. Like, their natural movement is their own. So I don't really wanna modify how kids are moving. We 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 grow up knowing how to move our bodies and we forget at some point, right? Like, the most natural movement I think are these toddlers as they're learning to walk. And I think letting that process be natural is the most important part. Now you have to support it, and I think a lot of times if I could make one modification to what we do with kids is screens. I was at the airport the other day, and my wife and I are walking down, we're going to the TSA line, and I look over and there's a young family, and a, 3-year-old, he's laying on his belly watching an iPad, right? And it just brought to mind, I wonder how long that kid spends on the iPad. And that family, to be fair, that may yeah, obviously, you know, that's a unique situation, but our kids, I see it. I've seen it in my younger colleagues. I've seen it. My kids spent too much time on screens, but the very young spending a lot of time on screens and not moving to their full potential, I think is damaging us. I think it's damaging our kids.
Well,
I
I
really
think
would
you're
like to
right.
see that go in the other direction.
I think you're right, though, like, in a sense, okay, you're saying, like, I don't wanna necessarily change kids from moving, but what needs to change is our encouragement to create an environment where they need to move, and if you're on
Yeah.
screens, you don't move.
No, no, we are using these screens as a distraction so that we don't have to chase our kids. but the chasing our kids is good for the kid, and it's good for us too, right?
Right.
So,
So like that we
you
need
know,
that movement as well. Yeah.
yeah, yeah. I mean, and exhausted mothers will definitely not agree, um, but I would argue that it's very unnatural for a human being to sit the first part of their development and watch a screen. That's not how we evolved to be, physically successful.
Okay, so let's move on to like 20-ish to 30-ish age. So clearly we want to be thinking about diet because you talked about how certain foods are going to be causing inflammation and then affecting the joints. What movements should maybe that age group be thinking about that? Because really what I'm trying to get at is like what kind of prevention can we naturally what does natural prevention look like through the different decades?
Ooh, that's a complicated we got a lot of time to be here because that's a big question.
We'll
So
boil it down
I
to
don't think you can break it
a couple of things.
I don't think you can break it down to the different decades. I think we need to we need to lift heavy weights with good technique and ensure that we have good mobility. So a combined system of movement it's probably what's going to be the best for most people. And that is going to involve a mix of high intensity exercise, hit training type workouts, weight lifting type exercises for strength and to prevent muscle loss, maintain our bone health, and then a type of flowing movement like yoga, something to really stretch the joints and maintain the compliance of the ligaments, to maintain elasticity of our tissues, to keep us stretchy, right? The changes that we see with age is we all get stiffer. Well, if we can do something at a young age and develop habits to combat that, if you look at people who do yoga into their 70s, they have much less joint pain, particularly back pain. But it's very powerfully impactful. So that combination, so we need to do something that's metabolically active, like high intensity exercise. We need to maintain our aerobic capacity. We need to build our musculoskeletal system by loading it with weights, and then we need to maintain that tissue's compliance. We need to maintain our mobility, so we need to stay limber.
Would you agree that it's hard to learn to be active and better to start being active at the youngest age possible so that you, to your point, the habit of being active is there as you get older? Because it's something I've always reflected back to my daughter. Like, I was always like, to my oldest daughter, I'm like, you need to walk to school. And she's like, but it's cold or it's this or that. And she's complaining. I'm like, no, no, but you need to be in the habit of using your body now because if you don't do that now, you think it's going to be easier when you're in your 30s or your 40s? It's going to be harder. Because in a sense, doesn't the body have a memory?
Oh yeah, the body has a that's yeah, your body has a memory for sure, 100%. You and activity levels are personality dependent too. Some people are not naturally as active as others. Um, but we know that people who grow up on a farm are tend to be much more active, you know, at an earlier, younger age, right? Country folks versus somebody who grows up in a city and, has to have play dates and is more limited in how they can get outside and do things. Um, I I have a question though, like, you're making your daughter walk to school. Don't you live in Boston?
Just outside. Yeah.
I mean, but you made her in, like, the winter?
Well, I mean, when it's snowing, we don't. But more to what you just said is what we're doing. What I'm trying to educate her on is that her personality is such where she is more used to, like she's an artist. She likes to sit and draw in bed, like listen to music. Like she's not inclined to join an athletic club or team. Like she's not inclined to be as physical as let's say I was taught when I was younger. And I am in my 50-year-old self going like, but honey, like, it's really hard to learn to be active. like you have to, like, I believe you have to start young in terms of the mindset of like using that body. If it's not a natural inclination, you have to almost will yourself to do it at a younger age because it's just going to get harder as you get older. That's kind of the point I'm trying to make.
Very much. If you don't get in the habit of being active at a young age, then certainly it's really hard to start that habit later. I read a story about a guy who didn't start weightlifting until his mid-70s though. So, I mean, and, is now lifting heavy weight and doing all this crazy stuff. I don't think that means that we can't ever make a habit, but it definitely makes it harder if you don't start young and if we don't support our kids in having sort of active habits. Um, Not in but in your daughter's case, like, not everybody wants to be on the soccer field. Um, the the when I talk to parents about this, I always encourage them to, find something that's active that really sparks your kid. Maybe it's not soccer, maybe it's band, and we can do marching band. That's active. Um, Maybe it's dance, maybe it's mixed martial arts. But having habits of being fit and moving our bodies at a young age is extremely important.
Well, I'm glad you actually brought this up because that was going to be another question of mine is that so, we were talking about you had mentioned heavy weights, doing some stretching, like yoga, like in terms of supporting like longevity and optimal health, right? For your joints and
Mhm.
your skeletal muscles as you age. Where does I mean, you are someone who paraglides, like you do all these adventure kind of sports that in many ways aren't just physical, but they're creative. Like they're
Mhm.
stretching your mind and and you could even say that they're fun. I don't know if they're fun to you, but they could like I hear the things you do and I'm like, that sounds fun. Right. So where do you see that being important? Like that, like, do you think it's important for not just mind health, but physical health to, like, make sure that it's that mindset of enjoying whatever it is you're doing. Do you think that's gonna help you age better and continue moving even more as you get older?
Yeah, for me, adventure is expansive. We know that as we age, our thought patterns tend to become more rigid, right? That's a pretty well recognized. I think we all feel that. An important point of longevity is that if our minds will age um, much slower and become much rigid, much less rigid if we have new expansive experiences. And so I'm lucky and I do have fun. Like I paraglide all over the world, big mountain ranges in the Andes and the Alps and um, you know, at the foothills of Mount Everest. I've been all over. And it is fun. What I love about flying and flight sports and in extreme sports in the mountaineering realm are that you're getting to have deep and impactful experiences with your environment, with nature, with the earth, with the sky, with the elements, with rock and trees and in a natural environment that is deeply immersive. And that is, I feel, really good for my brain. It really helps my brain to use all of its functions at the same time because we're making decisions at the same time as we're making small motions, at the same time as we're making larger motions. And those types of activities, like paragliding or kiteboarding and surfers, anybody that loves to do that at at a certain level will agree that it's good for their brain just like it's good for their body. And that I think my take home for other people. You might not paraglide, you might not surf, but doing something that is good for your mind as well as good for your body at the same time gives you magnifies the benefits. It increases the benefits of that activity. So and for a lot of people, that might be gardening. It's a physical plus a mental activity. Um, Cooking is a physical plus a mental activity, right? Surgery is a physical plus a mental activity. And so are the things that I love to do.
Now you told me, that you're no longer doing surgery. What caused that result?
I think a big point of it is my reaction to the fact I don't believe that a lot of orthopedic surgeries that are done today are strictly necessary. We're doing scopes on arthritic knees. We've known that that's not a good idea since, the early 2000s when there was this massive study that came out that showed it was no better than a sham surgery. We're doing, certain types of shoulder surgeries and, we're doing joint replacements too early, and that, really started to stick for me. I was doing a lot of surgery. I felt very pushed to do surgery by the hospital that I was employed by. Um, and so when I came out into my private practice, I was really interested in finding regenerative ways to treat joints that that don't lead us down a surgical pathway or that at least prevent us from needing surgery for a while.
And
And
so
so that's the
what are some of those like non-surgical like I'm just thinking about the person who is getting told by their doctor, "Hey, you need to have this hip replacement or this knee surgery or whatever, knee replacement." How how should they, if they'd heard this episode before that, or even maybe they just got told that, how should they be what else should they be considering, or how should they be rethinking what their doctor's saying?
well, they what we do at Pinnacle Integrative Orthopedics, which is my practice that I have here in Wichita Falls, is we use the body's own ability to heal itself. We magnify that. We use that to treat joint pain and to heal the whole person. So we use functional medicine approaches. We take into account the whole metabolism, not just the joint itself. And so this allows us not just to help with knee pain, but help with type 2 diabetes and gut problems and hormone axis issues and you know issues of bone loss and loss of muscle mass. So when we combine those approaches, we can be really successful in treating a joint. And with the joint itself, we can use multiple different treatments to prevent or delay surgery. We can use the patient's own blood and make PRP, platelet rich plasma. We can use bone marrow and create and take stem cells out of the bone marrow or the fat cells, and then we can treat the joint in a way that we can actually slow down the progression of arthritis is the goal, right? And to nourish that joint and prevent further damage. In the traditional world, when you go for that first opinion to your orthopedic surgeon and he says, "Well, you have arthritis, it's too far gone to do anything. I can give you a steroid injection." Well, that steroid injection that he gives you is actually damaging to the joint itself. It's like a steroid injection in your joint is like if your kitchen's on fire and you're like, "Oh, fuck it, I'll turn this smoke alarm off." So that's what a steroid does.
Really?
That's what it's what it does to the joint. It basically tricks our joint into thinking there's not a problem, and by dampening the inflammatory process that's going for a very small amount of time, and then you'll typically have a rebound where it's even worse. And not only that, but these steroid injections that a lot of, traditional medical practices are doing have been shown to damage the joint structures. It damages the tissue around the joint, it damages the surfaces of the cartilage themselves. And if you get more than 2 or 3 steroid injections in a year, it's been shown to progress your arthritis quite rapidly. So,
Wow.
we wanna do things that support your joint health and healing rather than damage it and force you into surgery that you might not have needed if you hadn't started down that path.
I wonder, because I'm thinking of a conversation I just even had a week ago with somebody where they have, oh, it's a hip thing. Yeah, so he was in a lot of back pain, and, and he said, "Yeah, it's pretty intense, like, I've had it now for long enough." He said, I just need to get a hip replacement." Like, he just saw it as, like, that's the only answer, and I think most people are being suggested that, and I think most people are being conditioned to believe that. So, how should people be rethinking that? So, if someone is telling you that, "Hey, this is the only answer," what do you wanna tell them right now?
First of all, not every pain needs surgery. So, and we've been conditioned as Americans to think that our health is worth a $20 copay, and that's it. Right? And we've also been conditioned that we either get a pill to fix our problem or we have a procedure to fix our problem. And what I would want to tell people is that let's think out of the box with our health, because it's much, much more important that we take care of ourselves for the long term rather than just look for a short term or a right now fix. Right? So if you are being told that you need a joint replacement, there is definitely a chance that you would benefit from a joint replacement. But if you have a second thought about getting that, then you should certainly look for options that, like what we do. Look for regenerative options. Look for non-surgical ways to help yourself. Um, I think a big way that we should think about joint pain is actually the whole system. See, the joint pain is not a joint only problem. It's a system problem. And it's oftentimes you can have an arthritic knee in a person that doesn't bother them because the rest of them is not inflamed. It's when our system is compromised and the joint is compromised that we have a real problem. And part of the issue is that the traditional system doesn't address that underlying problem. It'll help you fix the knee in a lot of cases, but then you still have the inflammation. You still have diabetes. You still have these other metabolic issues. And if we don't take care of those, you're not going to do as well after a surgery either. So look at it as a whole system issue and start to think of it as a well, maybe it's not just a surgery that I need. Maybe I need to think more about regenerating my joint or healing my joint pain. Maybe I need to think about what are some of the other ways that I can help with my joint pain, right? Mindfulness. It's interesting. They did a study on meditation and chronic pain, and daily meditation practices of 20 minutes helped people with chronic pain reduce their pain levels by like 20 or 30%.
Yeah,
That's
I love
crazy.
that you're introducing these thoughts to people, because I think this is what's important, because most
Yeah,
people, we only know to make a change when we have contrast, right? And most people, all they do is they see their doctors or their orthopedic surgeons. Like, those are the only people they're seeing. And if that person is not speaking about it the way you are, then they only see one path.
right.
So there's no way the system's going to change until people recognize there is another path. And maybe we should first explore the other paths before we go down this path of, oh no, I have to have surgery. Like, maybe there isn't a have to, but you don't know until you try or explore, go down the other path. So I love that you're bringing awareness of these other paths, mindset, and as we talked about, kind of having fun really does seem like we're losing a lot of that, um, awareness of lightening our mindset and lightening our physical, like lightening why we have to be physical. Like, I think everyone, even myself, like, I go to a gym and it's like 45 minutes, go, 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 right? It's like, get it done. But there's a certain, I have to wonder if it's similar to when you sit down for a meal. If you're in parasympathetic state, you're gonna better digest that meal than if you're not. And I have to wonder if the same goes for your physical body. Are your joints gonna be more limber? Are you gonna be just kind of more, if you're more at ease and lighter energetically, is your body gonna move better?
I haven't seen any studies on that. There might be, but my heart and my experience says yes. You can see it in your own loved ones and family members. We see this sense of heaviness. Well, we could see a lot of sense of heaviness in the way that people move now. Um, e Everybody feels lighter when they're happy, and everybody feels lighter when they're in a positive space, so I do believe that mindset drastically impacts the way that we move. It also drastically impacts our own health. So it's it's also been shown very clearly that people who have a positive outlook on their health live a substantial amount longer than people who don't. People who are generally positive versus people who are negative. I think that's really fascinating. It also is very telling. I mean, we write the reality of our lives every moment with our choices and the way that we choose to view what we do. And what we do with our health is, of course, a story that we write ourselves, right? It is the ultimate game that you can play with the universe. You can impact your health in a number of different ways, and it can be anywhere from I'm going to drink less to I'm going to move just a little bit more to I'm going to eat, organ meats to add my essentials. Um, I really do believe that health is an intention, and it's even more so when we're doing the types of procedures that I do with regenerative medicine. But mindset is the basis of everything we do, and that is the big take home for me as a physician from that little kid that was in medical school to the kind of grizzled bearded veteran that I am today, is that piece is the most important segment, and we lose it a lot.
Well, I love this. I really enjoyed talking about this. I know that having an orthopedic surgeon on Everyday Ancestral might seem like a stretch, but I think it's really important for us to be thinking about, well, what are ancestral movements, and what is happening in that orthopedic surgery has become such a money making industry, and such a like I think I've met probably more people in the last 10 years that have had surgeries from an orthopedic surgeon than I ever have in my lifetime. And I know you could say, well, it's your age, but my guess is that it's actually no, it's probably because this system, to your point of what you started out saying, is this system is pushing more and more people towards orthopedic surgery. So clearly, like there's a disconnect going on with ancestral movements and modern lifestyle. So I'm really grateful for this conversation, and helping people rethink, what an ancestral movement is, what our mindset can be, and maybe also the questions we should be asking prior to going down the path of surgery. So I really appreciate that. Thank you for coming on the show. I typically ask everyone this final question, but in a sense, you have answered it. But I'll just ask it and see if your answer is different than squatting. If you could wave a magic wand and bring back one ancestral practice, what would it be?
Spending a dark night around the fire with your close
Mm,
family.
I love
Speaking
that.
truth to your loved ones and telling stories. That's what I would really bring back.
Love it. Yeah, so important. So important. Connecting. Not like where you see people go to dinner and everyone's on a phone, and no one's talking, no
Yeah.
one's connecting. Like, yeah, very, very different. And how sad if we have generations that miss out on that, which we probably already do.
Yeah. We try really. I think we can all be a little bit more intentional about how we communicate with the people that we love around us and how we how we see the world for sure. And sitting together and looking in each other's eyes, I think is a great place to start.
I love it. Well, I'm so glad that as a doctor, someone, a surgeon, someone that started out with huge ego and just wanting to make money, that you've come to the place where you are about looking at people in the eye, and you are about bringing the humanity, and looking at the system from the whole versus just the joint. So I think you really showcased a beautiful journey, Josh. I appreciate you vulnerably sharing it, and I'm hoping maybe there's an orthopedic surgeon out there that's not in that place that hears this and says, "Oh, well, maybe I should start exploring that." Because
Yeah.
I think it's important that your light get brighter so that maybe you shine it onto someone that needs to hear it or see it. Um, so thank you. Thanks for coming on, and thank you all. Actually, before we go, so where should people go if they want to kind of connect with you? Because they can connect with you. They don't have to live in Wichita Falls to work with you, right?
No, we have people fly in from all over the world to Wichita Falls, Texas, which I didn't imagine in the business plan, but the furthest that we've had so far is South Africa. You can connect with us. It's www.pinnacleorthowf.com or Pinnacle Sports Medicine. You can look me up at Dr. Joshua Schachter on Instagram and Facebook, and we at Pinnacle Integrative Orthopedics on Facebook. We also have a YouTube channel at Dr. Joshua Schachter. I'm on TikTok. I'm everywhere. Come stalk me.
And can they find any of your paragliding videos? Do you ever put those out?
Yeah, it's on there. Well, that's on, you
Okay.
can look on my personal page. I've got a bunch of paragliding on there.
Yeah, I've seen some all y'all, so I recommend checking them out. They're really, really stellar. Thank you, Josh. Appreciate you coming on and appreciate you.
Appreciate you, brother.
Thank you all for just joining us on this episode of Everyday Ancestral. Remember, stay curious and tell a friend about us. We wanna keep expanding this message of bringing ancestral ideas into this modern society. Thank you. Thank you so much for joining me on Everyday Ancestral. If you enjoyed this episode, hit subscribe so you don't miss the next one. You can find the show notes, links, and resources mentioned at eatpluck.com. That's EATPLUCK.com. And hey, if you know someone who'd get something out of this, share it with them too. Stay curious, live well, and keep it ancestral.